Hi, I'm Dr. Kelly Starrett, and I want to talk with you about neck pain and some things you might not be doing that could help to resolve this chronic problem or pain in the neck, as it were. So first of all, we've always got access to H-wave, which can help us desensitize and break that pain cycle so that we can get about our lives, which is really important. We love high frequency here, and even just some non-fatiguing muscle contraction to improve blood flow to those ischemic tissues. So that's handling some of the acute sort of problems that we see around sort of the common neck sort of related dysfunction. There's a couple things that I want to share that we always layer in with our patients and athletes who are experiencing neck pain. The first is we ask, is this a position where I can take the biggest breath? So oftentimes we see that we inadvertently adopt postures and shapes that don't allow us to ventilate as effectively. And what ends up happening if I'm slouching at my computer or I'm on the bike or whatever I'm doing, it potentially means that I'm truncating the function of my diaphragm, and I end up having to pick up my breathing apparatus with my sort of passive accessory breathing musculature, which means I do a lot of neck breathing. So instead, what we say is, instead of trying to find a perfect posture, which doesn't really exist and it's hard to maintain, we say, hey, if I'm feeling some tension in my neck or discomfort, is there a position where I could take a bigger breath? So it turns out that I can intuitively sort of figure out which shapes allow me to be able to ventilate more effectively. And when I ventilate more effectively, that hints about an organization around my neck and spine and shoulders that allow me to sort of access better physiology. So that's number one. Just, hey, can I take a bigger breath in a different shape? Let's adopt that shape. Number two, one of the problems with neck pain is that we don't really want to load our neck. And oftentimes we see a lot of pain inhibition. The pain has actually shut down my ability to access a lot of the muscle functions that stabilize my head, and that creates sort of a vicious cycle. So when we are seeing people with back pain or any other system, we think, hey, we've got to get you moving and loaded. So what does that mean? Well, number one, we could simply take our eyes and look as far as we can and try to look past. So this is a form of loading and movement. Oftentimes when we're in neck pain, we don't move our necks at all. So turning your head a little bit and really trying to engage with your eyes can go a long way to recruiting, by leading with the eyes, better deep neck musculature. Number two, simple isometrics. Just put your hand on your head and create a little force and make your neck do its job. Make it work a little bit and stabilize a little bit. These are very safe and very easy inputs, and it's shocking what happens when you just do a little 30-second hold. Put the tongue to the roof of your mouth, like you say the word thin, thin, and then just hold there and breathe while you develop a 30-second contraction. It doesn't have to be very powerful, but just reminding my neck, hey, you're going to have to work to support my head. And I can do that in all of the ranges and positions. And again, 30 seconds isn't magic, but it's long enough that we can actually tell the brain to pay attention. The last thing we would do is say, hey, let's get your shoulders involved. Oftentimes we fail to appreciate that your shoulders and your upper back and your neck are a system. And when we can get a little input into the shoulder system, oftentimes that helps to stabilize and sort of wake up and reclaim function of the whole neck trunk system. So here I have just a little stretch rubber band. This could be a t-shirt even. And all I'm going to do is just put a little load, an isometric load. Again, those 30 seconds are magical. I don't have to resist. I don't have to do a lot of reps. Just build some tension in that and be as clever as you want. Here I am just rowing a little bit, pulling, right? I can do a little bit of a push. I can do that in all of these directions. And what you'll see is that just by making your shoulders work a little bit, especially when you have neck pain, sub-threshold isometrics, a little tension at the end range, you'll see that we start to remind the body that the role of the shoulders and the neck is to support the head. And that's one of the ways, and more importantly, one of the best features of resolving our neck pain once and for all. We've got to get our necks comfortable with load and comfortable with moving. We've got a great system to manage ischemia and pain and to get those tissues pumping and full of blood again. Once we have that opportunity, let's go ahead and remind ourselves it's okay to load our heads and necks gently, and that is how we manage neck pain.